My name is Leslie, and I live with complex post-traumatic stress disorder and an eating disorder. And I've lived with these conditions a good chunk of my life. I stopped eating, and I stopped sleeping, and I stopped taking care of myself. I stopped taking care of my home, and I stopped caring. My anxiety was so severe that I could barely walk to the bathroom. I went about my daily routine, and I passed out in a public setting, and the ambulance was called. And they got me to the hospital, and they checked my blood sugar, and they checked my blood pressure, and I was not well. But more importantly, I wasn't well mentally. I was on the verge of another suicidal ideation, and I was ready to be done. I was done battling what felt like a monster that haunted me my whole life. I was in the emergency room, and they evaluated me and decided that I needed a psychiatric stay, but there were no beds available. So for 30 hours, I sat in the emergency room by myself, waiting for a bed, while I was in crisis. So I was still having anxiety, I was still very depressed, I still was suicidal. By the time there was an actual bed, the bed was in another county. And to be honest, the entire stay was not therapeutic at all. I left there feeling almost as defeated as I did when I walked in the door.
I'm Amy Coe, and I am the Interim Executive Director with the Wood County Alcohol, Drug Addiction, and Mental Health Board. The Crisis Stabilization Unit has been something this community has really needed for a long time. As a previous therapist and clinician working in behavioral health in this community, I know how difficult it has been to find placement for individuals that are experiencing a mental health crisis. So having a crisis stabilization for our community where I know exactly where to turn, I know exactly who to talk to, there is a drop-off for law enforcement. We can serve those clients that are the most in need in our community.
My name is Jen Emma Heiser. I am the Senior Director of Services for Unison in Wood County. The Wood County Crisis Line is a line that is available to all folks in Wood County. It is operated 24 hours a day, 7 days a week, all year long. It is a direct line to licensed therapists and counselors for people that are experiencing an increase in mental health symptoms of any kind, just needing someone to talk to, all the way to thinking they might need a hospitalization. When a person calls the Wood County Crisis Line, again, they're directly connected with a licensed clinician. Then they kind of do a triage process. Sometimes that's just talking with the client, coming up with a plan to maybe connect them to services, get them some ongoing need. It may also be a situation where they think there's a higher level of care needed, so they may dispatch our mobile crisis team.
My name is Jen Tucker. I am the crisis coordinator for Unison's mobile crisis unit in Wood County. What constitutes a mental health crisis is really anything ranging from anxiety, a panic attack, to full-blown psychotic episode. Mobile crisis involves a team that responds to any mental health crisis 24 hours a day, 7 days a week, that takes place in Wood County. So we meet people at their typically highest stress level and triage, de-escalate, and hopefully link them to the appropriate services.
My name is Jeff DeLay. I'm CEO of Unison Health. I am so proud to personally be involved in this project. I've seen the benefits of crisis stabilization units in other communities, and I'm proud to work with the leadership of the Wood County Adams Board and my staff, who, if it wasn't for their support and their investment in this project, again, we wouldn't be here today. On any given day in Wood County, 2 to 4 people are going to have a behavioral health crisis. Before the Crisis Stabilization Unit came, those individuals would have to travel up to Toledo and be admitted in one of the psychiatric hospitals. But now that we've got this program here in Wood County, we're able to treat those individuals here in the community.
The biggest thing the CSU will do will be to keep us in our community. It's here, it's available to us it's accessible, and the outpatient services that go along with it are extraordinary.
So I believe the impact on the crisis stabilization unit in our community is huge. There are a good number of individuals that we see that do not meet criteria for hospitalization. So by them directly coming to the CSU versus presenting in the ER, I think will free up a lot of time, a lot of space for those individuals that have significant medical issues.
My best hope is that this crisis stabilization unit will reduce trauma and reduce suicide deaths in our community.
The Wood County Crisis Line is such an important service because there's always somebody there to answer the phone, a live person that is a licensed clinician to talk with people in their darkest moments.
There is a great need for a place like this in our community. Like I said, it is a temporary stay. It is a place to do a reset. And sometimes that's all folks need. And we have been very thankful that Unison has presented this and followed through and come up with this exciting new type of treatment here in Wood County.
We could not have done this crisis stabilization unit if it wasn't for the support of the Wood County Adams Board. There's less than a handful of residential crisis stabilization units in the state of Ohio. This level of care is important because it allows us to treat Wood County residents within the community. It allows us to provide the supports that they need in the community, be closer to their families, be closer to the homes. And I can't thank their dedication enough for this being possible.